And welcome back to the Wellness Paradox podcast. I'm so grateful that you can join us on this journey towards greater human flourishing. As always, I'm your host, Michael Stack, an exercise physiologist by training and a health entrepreneur and a health educator by trade. And I'm fascinated by a phenomena I call the wellness paradox. This paradox, as I view it, is the trust, interaction, and communication gap that exists between fitness professionals and our medical community. This podcast is all about closing off that gap by disseminating the latest, most evidence-based, and most engaging information in the health sciences. And to do that in episode 107, we're joined by Dr. Svetlana Chamoun. Dr. Chamoun is a lifestyle medicine physician who has transitioned from an interventional cardiologist to, on some level, what she refers to as a behavioral cardiologist. And this conversation we're going to have today, I think, is a fascinating discussion, partly because it starts with the roots of Dr. Chamoun's story, which is kind of combinations of triumph and tragedy that have led her to this point in her life. And I think you'll find that story very compelling, but more importantly, her message very compelling about the importance of lifestyle intervention, lifestyle medicine, and making sure we take care of ourselves as allied health providers first in order to take care of the patients and the clients we serve. You know, as she said, you cannot drink from an empty cup. I think you'll find this conversation not only informative, but also very, very inspiring. Any information we'd like to share with you from today's episode can be found in the show notes page. That's by going to wellnessparadoxpod.com/episode 107. Please enjoy this conversation with Dr. Svetlana Chamoun. Today, we're delighted to be joined by Dr. Svetlana Chamoun. Dr. Chamoun, thank you so much for joining us.
You're welcome, Mike. Thank you for having me.
Very excited to have this conversation. We were connected by a mutual friend and guest of the podcast, Sammy, who's been on previously through the ACLM connections, the American College of Lifestyle Medicine. And we're going to have what I think is a really important conversation today around how to take care of ourselves as healthcare providers and allied health professionals. But before we dive into that, why don't you just give our audience a little bit more of an idea of your background to provide some context for the discussion?
Sure, Mike. Thank you for this question. And it's interesting that you ask me to provide the background and talk about my past a little bit, because this is very good in the context of today's conversation. I normally do not share my story because it's filled really with incredible hardships, and people want to hear, good stories, happy stories, right? But mine was kind of a chain of tragedies and triumphs that make perfect sense in our context today. So I was born and raised in Soviet Ukraine, and I enjoyed my perfect upbringing. It was filled with love and privilege and opportunity. But then things started changing. When I was 11, my dad, who was a dissident journalist, he was sent to a Siberian Gulag. And very shortly after that, I myself was struck with influenza that triggered influenza fulminant myocarditis that nearly killed me. But the good thing that came out of this was bonding with my physicians, with my doctors, and it set me on the path to medicine, essentially to becoming a doctor. And I entered medical school when I was only 17 and graduated with an MD at age 23. And then I got my PhD degree when I was 25. But then kind of things started falling apart in our country because the post-Soviet Ukraine really at that time descended into a chaos, complete chaos. And I was forced to leave my family, my children behind and take a plane to Cuba to leave the plane and defect as a refugee in Canada. And so I was kind of going, I was 26 at the time, and ahead of me was a complete unknown. So, and tragically, around the same time, I lost my dad to a suicide, and I lost my husband as well. So I found myself in Canada, completely isolated, without money or even a language to communicate. And so I took like random jobs to essentially survive, and I sent every single penny, back home to support my mom and my kids at that time. But then, kind of the light of the end of the tunnel came when I won the green card lottery. And I came to the United States. I passed all the tests, and I started my residency at one of the UVA, University of Virginia, I should say, programs. And at that time, it was also a time of immense challenges for me, because I was thinking about my mom, about my kids all the time, and going through the residency program. But it tested my resilience, it tested my resolve, and I emerged, victorious from that. I was able to bring my kids. And at that time, I was infatuated with interventional cardiology, not lifestyle medicine. Lifestyle medicine was not even in the, in the picture then. Yeah. So I got the position in the cardiology fellowship here in Philadelphia, and started working toward the interventional track. But then, fate intervened again, and I started having back pains during the long procedures in the cath lab. And the Temple University Hospital opened a brand new imaging fellowship, and they invited me to be their first fellow. And I accepted, mainly because, I had physical challenges standing in the cath lab. So I said, I'm good with this, so why not, try imaging? And I have graduated as a specialist in comprehensive cardiovascular imaging and never looked back since then. So, and then I landed my first job here on the main line of Philadelphia in a prestigious place, very good hospital, very good team. But, the thing is that this combination of being a single mom for 2 kids and working very long hours as a practicing cardiologist really took toll on my health, physical and mental. And I went through pretty severe burnout, Mike. That the first time. And so I had to change my life around, and I chose, better work-life balance. I went to work for industry, and for a while it was okay until this corporate, thing engulfed me kind of again. And I found myself working 12-hour days again. But then I remarried, and my husband, who was a practicing cardiologist here on the main line, he gave me the brochure for the annual lifestyle medicine, American College of Lifestyle Medicine conference. And he said, this is something that may interest you. And I attended the conference, got board certified shortly after that, and also got certified as a health and wellness coach. And, that helped me to improve my own well-being and work-life balance even further. And when the COVID struck in 2020, it really changed the life of the professional community around me. My former colleagues, my friends were really suffering, and the patients also. And it decimated this medical community around me. So it kind of cemented my beliefs that, a need of profound changes in the healthcare system was needed. And I could contribute to this change. I could contribute. So I left my corporate job, and I started Cardio Seeds with that mission to introduce pillars of lifestyle medicine, to spread the word that things can be done better, to help healthcare professionals take care of themselves. Unfortunately, life had something more in store for me. And so my mom got sick in Ukraine, and she died shortly after. And then 2 months later, the war on Ukraine started. And it really kind of really hit me hard, to be honest with you. So I was grieving, and to be honest with you, I had almost like a complete meltdown, and I was crying nonstop for months. But despite all that, I think God was looking after me, Mike, because like a series of miracles started happening around that time. So I had strength to launch the Cardio Seeds podcast in February 22. And I said, this venture was close to my heart always, to exploring, lifestyle medicine, resilience building, et cetera, et cetera. And so I saw the opportunity to tell my journey, to show people that if I could do it, anybody can do it, And so I started the podcast. And shortly after that, I was elected as a co-chair of the cardiology member interest group of the American College of Lifestyle Medicine. And that cemented my, belief that if you believe in yourself, and if you take care of your mental, or try to take care of your mental state and physical state, things will start falling into place, And I was honored by this position. I took this leadership role very seriously, and it gave me additional sense of purpose. And then I actually started expanding the Cardio Seeds to work with patients, with healthcare professionals, to introduce the lifestyle medicine pillars, and help them transform their workplaces. So it became kind of joint mission from my own story of surviving and thriving into encouraging and empowering my patients and fellow healthcare professionals to do the same.
Wow, what an important and compelling story. I mean, first, thank you for sharing, all of that. I think it's equal parts sad and inspiring to hear a story like that. But I think all the parts of that narrative are very much relevant to the conversation that we're having today. And, I think
so.
Yeah. And aside from the specific discussion, which I definitely want to dive into around Cardio Seeds, I think that it does kind of show the importance of, following your passion, listening to your heart, finding that purpose. I mean, your career, like many people's career, has not been, a linear path, but you found something that is very, purposeful and inspiring to you. And so above and beyond the discussion we're going to have today around Cardio Seeds, I think, that's such an important piece to take out of that story.
That's exactly right, Mike. That's exactly right. That's how I feel about it. And this is how I think people should come to that place individually, all of them, independent of circumstances. They have to come to that place where they can transform. They can transform themselves, and where the journey becomes transformative, not only, in surviving mode and stuff like that. And from that point on, when an individual journey becomes transformative, this is where they can start transforming people around them and empowering people around.
Yeah, absolutely. Well, let's talk about Cardio Seeds. Tell us a little bit about what it is, and I think you've really laid out nicely well what got you there. But let's talk a little bit more. You gave us the why. Now give us the what and the how. Tell us about Cardio Seeds.
Sure. So again, the pandemic emphasized the urgent need to address social determinants of health, to address mental health of both patients and healthcare professionals, and address the underlying causes of chronic disease, Mike, because I realized that, we know obviously that by now that 80 to 85% of chronic diseases can be prevented by healthy lifestyle choices, right? And knowing that kind of gave me this uncomfortable feeling that had the medical health system and healthcare professionals work together on doing just that, the majority of deaths and disabilities related to COVID-19 pandemic may not have happened. That was an eye-opening and enlightening feeling, when you know this. So the Cardio Seeds believes in teamwork and in education for, so we put teamwork and education in the heart of transforming people's lifestyle and larger workplaces. So stress and burnout. Stress and burnout is a centerpiece of our message at Cardio Seeds. So it's not just a minor inconvenience, Mike. So these are major cardiovascular risk factors, right? They can wreak real havoc on our hearts and our well-being altogether. And we are at Cardio Seeds committed to providing comprehensive resources and programs to both patients and healthcare professionals, teams, administrators, healthcare organizations to tackle those issues on both individual and healthcare organizational level. So, in a nutshell, our mission is to cultivate a happier and a healthier healthcare landscape for everyone involved. So our clients range really from patients or individual healthcare professionals who experience burnout or may need primary and secondary cardiovascular prevention, right? But we do it with a heavy emphasis on burnout prevention and management. And they range to healthcare organizations, administrators, and teams. So we enable all of them to make changes in their personal, societal, and systemic environments to improve their workplaces as well. So for individual clients, we empower them to start making lifestyle changes and make them in a sustainable fashion. We introduce all the pillars to lifestyle medicine with focus on those individual needs that people may lack in their lives, or professional or personal lives, right? Whether it's insufficient sleep or it's too much workload, et cetera, et cetera. So we empower them with tools to change those things in a sustainable fashion, including their workplaces, because we think that if the workplaces around them aren't addressing those individual pillars in their lives, it doesn't make any sense, right? So, and we are not about treating symptoms. We are about restoring health and doing it in a sustained fashion. So we don't use, pills or procedures. We use plain holistic approach, lifestyle interventions, behavioral coaching, career consulting, and stuff like that. And creativity is in the center of our approach as well. But we also extend our services, as I said, to organizations and as corporations, for instance, or healthcare organizations, with or without burnout. It really doesn't matter whether they have issues with that or not, to improve teamwork, improve team cohesiveness, improve social interactions between people. All of that reduces burnout. And we provide them with tools of organizational changes, how to reduce this unnecessary, like GROSS, or getting rid of stupid stuff, as the American Medical Association said. So we coach them to do all of the above.
Yeah, it's so important. I mean, and we hear about burnout in all occupations right now. Certainly in healthcare, it's an epidemic, issue, and it's causing, real challenges. And it's exciting to hear how you're going about addressing it. And one of the programs you developed is the Reclaim program. And so I'd like you to unpack that program a little bit more. But even I suspect there's some meaning to the name behind Reclaim. So maybe you could touch on the meaning behind the name and then explain a little bit more about the program.
Sure, Mike. That's a wonderful question. And Reclaim, conceptually, reclaim means reclaiming one's best health, energy, purpose, meaning of life and professional life, and purpose, and obviously health and wellness and vigor, right? Reclaiming all of that from this perpetual vicious cycle of stress, of running around, et cetera, et cetera. So, but it's not only the name to reclaim best health, it's also an acronym. And it stands for those steps that we introduce to each of our patients or each of our clients, starting with recognition of recognizing. R stands for recognizing the problem, and then evaluating it, and so on. Then L stands for love or practicing self-care, right? And taking care of your patients or your colleagues, etc., in a similar way, or teaching them, introducing those tools, how to change workplaces to your colleagues. So our motto actually is to take one program, then teach two colleagues, and to mentor many. So M, among other things, stands for mentorship. And we use many tools in Reclaim. So the program has lifestyle interventions, of course, as I told you. And again, the stress of burnout cannot be brushed off, because they're serious risk factors, Mike, for cardiovascular disease. They cause, especially when unaddressed and for a long time, chronic stress, unaddressed stress, causes everything from sudden cardiac death. It's been well documented in literature, to hypertension, coronary heart disease, strokes, atrial fibrillation, strokes, right? Hyperlipidemia, changes in appetite due to changes in hormonal status, and obesity because of that. I said already, hypertension. My goodness, all of that. And so by addressing just stress and burnout alone, one can bring this whole issue, to this lower threshold, or should I say elevated threshold for cardiovascular risk, right? So this one factor. And we use lifestyle interventions, if appropriate and when appropriate. Behavioral cardiology. This is a new, almost new field. I feel like a cardiologist becomes a behavioralist, right? So we do the stages of readiness and address every stage of readiness, and advocate for sustainable changes. We do lots of coaching and creativity enhancement. So basically, we aim to achieve optimal physical and emotional health and transform workplaces. And as a result of that, physicians or nurses or practitioners who go through the program, they introduce those elements in their practice. And this is such a delight for us to see when it triggers kind of a chain effect, Mike, and practitioners start using pillars of lifestyle medicine in their practice, start mentoring their trainees, et cetera, et cetera. So it's a wonderful thing to watch and observe.
I'd like to take a quick break from today's episode to tell you a little bit more about one of our strategic partners as a podcast. As many of you know, the Wellness Paradox is all about closing off the trust, interaction, and communication gap between fitness professionals and the medical community. And no organization does that better than the Medical Fitness Association. They are the professional member association for the medical fitness industry. And this is the industry that integrates directly with healthcare in many facilities throughout the entire country. The MFA is your go-to source for all things medical fitness. They provide newsletters, webinars. They even have standards and guidelines for medical fitness facilities. They do events around the entire country. And most importantly, they are one of the more engaging networks in the entire fitness industry. I personally have benefited from the network that I've developed through the Medical Fitness Association. And I highly recommend that all of you that are interested in solving the wellness paradox engage with the MFA. To find out more about the Medical Fitness Association, you can go to their website, medicalfitness.org. That's medicalfitness.org. Now back to today's episode. I love the behavioral cardiology. That's actually not a term I've directly heard before, but it does stand in such stark contrast to the interventional
Yes.
cardiology that you were initially trained in.
Right, right. And there is a thing such as behavioral cardiology. You would not believe, especially in the most recent publications by the American College of Cardiology. If you read our journal, JAC, Journal of the American College of Cardiology, you will see how much emphasis is placed on behavioral aspects of patients' lifestyles and their, risk factors related to behavior. And behavioral cardiology emphasizes the partnering with patients, not just simply inflicting treatments on them, but partnering with them on a journey to restore their best health. And I say restore the best health because they were born, the majority of them were born healthy. So to get them where they want to be in their life is the most rewarding thing I have seen in my practice.
Yeah, and I know this resonates with so many people, that are listening to this podcast. And on that note, I'm going to ask probably a really hard question because you're so knowledgeable about what you developed. But we have a lot of fitness and wellness professionals that listen to this podcast. That's our primary audience,
Right.
and they're working with clients and patients, but they're also allied health professionals themselves. Are there a couple of lessons in particular that you could pick out that you'd like to tell our audience about that they could apply either to themselves, first, kind of, put your own oxygen mask on first before you help others, and then secondly to their patients or clients?
Yeah, absolutely. It's Reclaim and what we do is totally translatable and can, benefit to both fitness and wellness professionals just as much as it benefits patients and as it benefits doctors and nurses, right? So the thing is that we all collectively as healthcare professionals should understand the importance of our personal well-being, right? One cannot pour from an empty cup, right? Or cannot drink from an empty cup. So before approaching our patients, this issue of, self-care has to be emphasized, even though I know that fitness and wellness professionals should theoretically embody wellness, but sometimes the first part of the wellness paradox, in my opinion, is that they get so stressed out trying to, work with patients or run around, etc., that they forget about themselves, about their own, mainly mental, I think, wellness, not as much physical, because physical they embody it, right? Because they're, some of them are personal trainers, etc. So self-care is not luxury, Mike. It's a necessity for all of us, right? So learning that and remembering that our all well-being will also help our patients, because when they intuitively know whether we are okay or not.
Yeah.
And creating a supportive environment for one another, and that link with mainstream medicine, creating a supportive and safe environment where people can be treated and viewed as a whole, as a holistic approach, both at work, by one another, right? By creating this relaxed environment of camaraderie, Mike, at work, and also a safe place, safe haven for our patients to be comfortable with practitioners, to be relaxed, to be assured that the practitioner practices the holistic approach, that they see the patient as a whole, not just as a diseased heart or diseased vessel somewhere in the leg that they have to blow with with that stent or whatever. But as far as the systemic approaches, I would say, emphasizing education. Education is the key, and empower other practitioners to do the same. So fitness and healthcare professionals can take some cues from Reclaim by educating clients about the importance of lifestyle choices and empowering them to take control of their health and their wellness, mental included, and they can provide tools, resources, motivation, etc., to both clients and their colleagues to do the same. And of course, collaboration and integration with mainstream healthcare. That's the must. And here I wanted to ask your opinion about that as well. What you think about this wellness paradox? Let's talk about that maybe a little bit, because it bothers me, it bugs me, that this disconnect between, I would say, even us. I don't even think of myself, even being a cardiologist, as a mainstream healthcare professional anymore. I am trying to bridge that, gap between wellness professionals and mainstream medicine. So how do you see this?
I always love when the question gets turned back to me. Obviously this is something I'm very passionate about, because this is the kind of the mission I set out with the podcast. And it never ceases to amaze me how difficult it is to break down traditional silos. And, even within, and this from working in healthcare systems, even within the healthcare system, there are significant silos, let alone, outside the healthcare system to within the healthcare system. So what I have, came down to, from at least my perspective, through talking to a bunch of, brilliant guests, such as yourself. One of my big secrets for doing this podcast is I had this question of how to bridge this gap, and I really didn't have the answer. So I hope by interviewing a bunch of brilliant people, I would come up with the answer. And a lot of it in my mind comes down to a degree of, setting your ego aside on every level, exercising a little bit of humility, and building, trusted relationships with the goal of being entirely patient or client centered the entire time. I think that if we always thought in terms of how we could help that patient or that client in front of us, I think that would lead silos to break down, egos to fall, humility to become a little bit more prevalent. But it's hard because, and I'll say this and then I'll turn it back to you, because you know this probably better than I do. It's hard because I think individual allied health professionals and medical professionals believe in everything that we're talking about here, right? Like, I don't think anyone in healthcare thinks that what we're talking about is not the way we would like to approach this. I think the challenge is there are so many structural constraints in our healthcare system that sometimes that's the difficult part, to get around, which, that could be a whole nother conversation. But I guess my simple way of saying it is, breaking down the silos through trust and humility and setting your ego aside seems to be the way forward.
Yeah, I completely agree. I was listening to your podcast and thinking about this part of the paradox, where we have this disconnect. This is so counterintuitive, Mike, to me at least, right? As a combined holistic wellness professional and mainstream cardiologist. I was there for 20 years practicing cardiology, and I prescribed the pills and procedures, etc. And it bothers me now tremendously. And what I think the problem is? I think the problem is that there is no place, at least now in the current healthcare system model, for fitness and wellness professionals, or at least the place is limited. The place is limited, and because the traditional healthcare model still primarily focuses on disease, not on wellness, not on health, not on maintaining health, but they meet the patient during the disease, during crisis, and then everything falls, starts with that, right? The premise starts with meeting patients when they already have disease. So the separation is often referred as working in silos, as you said, and there are so many ways of bridging this gap, Mike, in my opinion. But as you said, breaking the communication barrier down is the most important thing in my opinion. So to empower other professionals to actively participate in providing holistic and preventative care. It's not easy. It's not intuitive. They have to be told and taught how to do this because there are no curricula that provides the training. We trained ourselves in this. I, as a cardiologist, trained myself in wellness and holistic approach. You were trained in some other things that kind of showed you the wider perspective. But believe it or not, mainstream physicians, despite their years and years of training, they still do not have this open-mindedness about the holistic approach. And they think that when we use or advocate meditation or mindfulness or even deep breathing, controlled breathing, or progressive muscle relaxation, all these are gimmicks, or all this don't have any background behind them, or evidence-based, because everything is evidence-based, everything is guidelines-based in practice. So there is no place for that interaction. And with the speed they work, that really reduces even the chances, right? Even if somebody is, enthusiastic about it, they only have 15-minute slot for patients.
Yeah.
So, there's so many missed opportunities because of this disconnect. Can you imagine uniting, making this, a stellar team that has fitness and wellness professionals on board for comprehensive patient care? On what level we could elevate their care, on what level we could benefit them comparing to traditional medicine alone.
Yeah, and
but
you're
that
right
requires,
about
go ahead.
You're right about not having a place. I mean, you summed it up very well with that. Is that everyone kind of fits in healthcare into these, for better or for worse, kind of into their place on the care continuum, and there is
exactly,
at least as of right now, there is no place for the fitness and the wellness profession.
That's what I think, but I would argue that if every one of us makes a conscious effort to change the situation and to educate, healthcare professionals, because they start biting. People start biting when they hear the same message over and over and over again, and when they see the, evidence of the fact that this is a much better approach. It actually reverses patients' conditions. It not just gives them a crutch, not only gives them a crutch to go through, from one crisis to another, but reverses conditions. They start thinking about it long and hard.
Yeah.
Trust me, because I work with my former colleagues, and many of them already converted onto this path. But we have to maintain an open line of communication and think how we can create, guidelines, workflows, work processes that can incorporate both traditional medicine and wellness and fitness professionals together. Guidelines is everything, as I said, in medicine, and they will be everything. They will be, but one can create protocols, have conferences together to exchange information and brainstorm the ways to work together. Don't you agree? And training programs, they need to be cross-trained. They need to introduce the curricula on nutrition, on fitness, on business, the aspects of business, and how to work together across the board with other professionals, other, allied professionals.
Absolutely. I can imagine most of our audience sitting there, nodding their head affirmatively to everything you're saying. Svetlana, this has been such a great conversation. And I want to keep it going, but I want to be respectful of our audience's time and your time. So before we end, can you tell our audience where they can go to find out more about the great work that you're doing?
Absolutely, Mike. Thank you. And they can find us on CardioSeed's website. We are there, and we're pretty much on the YouTube channel with the same name, CardioSeed's YouTube channel. We have a podcast, which also has the same name, CardioSeeds. We are on almost every platform that offers podcasts, and we are on LinkedIn, Instagram, Twitter, or now X, right?
Oh, X,
it's not
yes,
Twitter
it's
anymore,
Yep.
and Facebook. So I send you links to all my platforms, so you're welcome to post them under the podcast description, if you will.
Yeah, absolutely. We'll post all that on the show notes page. So before we bring our conversation to a close, I know we just talked a lot about how to address the wellness paradox, and I think a lot of what we talked about is very important. But I always really enjoy asking this question to physicians, because it's the opportunity for a physician to talk directly to fitness and wellness professionals. If you could distill everything we talked about, a couple minutes ago with regard to how to bridge this gap into one single piece of advice to the fitness and the wellness professionals that are listening to bridge this trust, interaction, and communication gap, what would be that piece of advice you would give?
I would say be a champion of this change. Take things in your own hands and change the environment around you. Educate as many people as possible around you about the virtues of bridging the gap. And empower them to do the same. So this chain reaction will spread throughout the medical community, and people will hear the message and will start paying attention and thinking how to extend their hand to you.
Absolutely. Dr. Svetlana Chamoun, thank you so much for joining us on the Wellness Paradox.
Mike Stack, thank you so much for having me.
Well, I hope you enjoyed that conversation as much as I did. If you found it insightful and informative, please share with your friends and colleagues. Those shares make a big difference for us. Any information we'd like to share with you from today's episode can be found on the show notes page. That's by going to wellnessparadoxpod.com/episode 107. Please be on the lookout for our next episode when it drops in 2 weeks. And don't forget to subscribe through your favorite podcast platform. Until we chat again next, please be well.